Hi, we're back. And today I want to talk about neuropathy. I reversed my neuropathy. I got rid of it. I feel great now. I can't walk barefoot because I can feel everything on the bottom of my feet. And believe me, that's a big difference because before it felt like I was wearing 5 pairs of socks and my feet were actually starting to get numb. So, and this is typical if you get diabetes or back surgery or just anything with the nerves. It can trigger some diabetes, some neuropathy. So anyway, people ask me, how did you get rid of your neuropathy? Well, I I followed the protocols that we always used in the hospital. You wash your feet every single night without fail. You take a shower, bath, whatever it is. You get your feet washed. You dry them well. Then you take some lotion. Just regular lotion. Cheap lotion. You can get it from the dollar store. You get it anywhere you want. Your lotion, cream, get the little things of Dove cream, whatever. It doesn't have to be expensive at all. It just has to be cream or lotion. You rub it into your feet really good. Just slather it on and rub it in. Then you put some cotton socks on. This is important. Those cotton socks kind of keep that lotion in your feet and they help your feet to absorb it. It's important to keep your feet supple. Keep that skin supple. Don't let it get rough. Don't let calluses form. You definitely don't want calluses on the bottom of your feet that go into sores that can't heal. So you're going to put that lotion on every night. You're going to wear those socks to bed. And when you get up in the morning and you get dressed, you're going to take off those socks and you're going to put on compression socks. Now, this is really, really important. You're not going to buy just any kind of compression socks, okay? You are going to get the good ones. These are great. These are MedPeds. You can get these at the Walmart pharmacy or any pharmacy, I guess. Or get you a good grade of 15-20, which is like medium compression socks. I do not recommend the ones that you find in department stores with this in the sock department with the pretty colors and the designs and all of that, because these socks have a tendency. You wear them the first time, they're okay. But when you wash them, they become really tight. You can't get them on. They don't have the flexibility anymore. So they're not the best of socks. And I bought a lot online that were the same way. I found that by going with brand name socks, these socks I've had for 4 years. They don't ever wear out. They're like iron. And just for 1 minute, I want to go back to the lotion. Don't spend your money on all these magnesium creams and magnesium lotions because they're going to get rid of neuropathy, because they're not. They're not going to get. I mean, just stop and think about this. If you've got a problem inside your limb, inside your foot, inside your hand, is there anything you're going to put on the outside of it that's going to affect what's going on inside? No. It's not, the derma isn't infected, it's the nerves that are embedded in that limb. So nothing you put outside is going to heal inside, okay? Voltaren might make the nerve endings in your skin dead so you can't feel anything. But that's about the only thing. And you don't want Voltaren. You don't want to not feel your feet. You can go to the doctor and get gabapentin. It does the same thing. It numbs your feet. You don't feel them. You don't want to do that. You want to feel your feet. So just go with any lotion that you're comfortable with, any. Could be Pond's, I don't care what it is. It could be Equiate. But as long as it's just a lotion that's has lanolin or something in it that keeps your skin moist on your feet, keeps your skin supple so that you don't get sores or calluses or anything like that. Okay, now the next thing that I did was I exercised. You exercise your feet. Just wiggle your toes, rotate your ankles into the figure eight, whatever. Keep exercising them every day. When you go to bed or when you sit down and watch TV, stick your legs straight out and flip your feet back and forth from your ankles. Give some exercise to those feet. You want to get the blood going to those limbs. You want the blood to circulate through the body and go to the feet and back. So, if by doing some feet exercise, a simple one, I'm not telling you to do anything strenuous. Just lean back, relax, watch a show, and just keep moving your feet. And do that. Do that every night. Do it for 15 minutes at a time, because that helps get the blood to the feet. It helps get the blood circulating in the feet. Now, the other thing that I want to tell you is you need to get up and walk throughout the day. If you can walk, if you're not wheelchair bound, get up and walk through the day. If you've had a stroke and you don't have good balance, hang on to the walls and walk. Go to your kitchen, walk around your island, walk around your table, whatever. But walk, move. Movement is so important, okay? Now, I bought an EMS pad. This is important. And it looks like this. Okay. As you can see, it's got the feet where you put your feet. And it's got the little button where you can press it for the strength that you want. I put it on high. I place my stocking feet, not bare feet. Don't do this with bare feet. I place my stocking feet on these little diagrams where the 2 feet are, and just sat at my desk and read the news and let my feet absorb that electrical stimulation. And I did this 3 times a day. I set it for 20 minutes on the highest amount, because remember, I'm in stocking feet, and 3 times a day. That's what I did. I did that for, I guess a couple of months. And this little routine paid off. It worked. In addition, I also took some ALA, alpha lipoic acid, and it helped me tremendously. I took it for 3 months, and I stopped for 2 months, and I take it for another 3 months. I would recommend that you check with your provider before you take it. Don't take anything without checking with your provider, because if you're not trained to know what chemicals can do, or if you haven't been through a holistic herbal course or anything, then you could accidentally harm your body. So please check with your provider or check with a holistic provider, and see that it's not going to interfere with your medications or anything else. Because some supplements do. Some supplements have interactions with medication. So those are the things that I did. And it took about 2 months for my neuropathy to go away. And every once in a while, I still wear compression socks. I love my compression socks. I wear them every day. Unless, if it's like in the summer when it's hot and I want to wear capris. Okay, so I'll wear capris every other day and not have to wear compression socks. But I try to wear them at least 3 times a week in the summer. Because they're wonderful. They force the blood back up to your heart. They keep the circulation going in the lower extremities. So, and that's what you want to do. And as a nurse working on the floor, I wore them because you're on your feet all day and you need something to support those limbs. So these are things that are, it's just common sense to do these things for your body. Now you can get rid of neuropathy because let me explain this to you. When nerves are damaged, they can regenerate. The body can regenerate nerves. The body is built to regenerate nerves. And you can do this. So if they're dead, that might be another story. I'm not sure. You may be able to revive them, but I think it would take a whole lot of hard work. But don't let them get that far. If you start to feel like you're getting neuropathy, you need to do something about it and reverse it. And that's not that difficult. It's not that difficult. It's just work. It's like anything else. It takes work. And I'm sure that you're going to find that this isn't that hard. You don't need gabapentin. You don't need Voltaren. You don't want to deaden your nerves so you don't feel the pain. You don't feel the feet. You don't know when the feet are dead and have to be amputated. Who wants to do that? No. So, I strongly suggest you talk to your provider. Ask them about the compression socks. Ask them about the lotion on your feet after washing them. Ask them about the EMS stimulator. If you feel like you want their blessings, get their blessings. I mean, these are not things that will harm you in any way. An EMS stimulator won't harm you in any way because you're going to put your stocking feet on it, not your bare feet. And you're going to take precautions. You're going to do things to self-preserve your own body. And that's what this is. How do you get neuropathy? Sitting. If you work in an office and you sit a lot, you can get neuropathy. Yes, you can. Because you are decreasing the circulation to your lower extremities. You have to get up and move around. You have to keep those extremities moving. And as you get older, it's harder for the blood to circulate through your body. So these are the things you have to take in consideration and take some steps to self-preserve your own nerves in your body. Self-preserve your own extremities. Don't get amputations. Don't let it get that far. If you're starting to get red rings around your ankles, you're in trouble. You're in serious trouble. You've neglected something for too long. And you're heading for an amputation. You need to stop and ask your provider, where am I? Where am I in my circulation? Where am I with my diabetes or whatever? Ask questions. Because you don't want everything to be a surprise. When you preserve your own health, you ask questions about your own health. You want to know what's going on. You want to know what you can do about it. And if your provider is one of those providers that says, well, nothing, that's just part of aging, find a new provider. Because I'm here to tell you that's not part of aging. That is the body breaking down. And any good provider will tell you what's going on and will explain to you what you can do to prevent it or to reverse it. And they will use the medications as a crutch while you're trying to heal yourself. And that's what medication's all about. It was never meant to be a long-term chronic situation. They didn't invent medications so that you could take them for the rest of your life. They invented medication as a crutch, something to lean on while your body is healing, and that's what it is. So you don't want to get into the rat race of just taking medicine and sitting, because you won't be happy with the outcome. So that's my little synopsis on neuropathy, and if you have questions, call me. I have no problem with that. I'm happy to talk to you and explain to you what I did and how I did it. And if I could do it at 76 years old, I know anybody can do it. Okay? So, till next time, we'll talk about cataracts.